Cloudcast Media.
Drew Schlosberg Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
I'm Drew Schlosberg, and we are so pleased to have a return appearance from our friends from La Jolla Cosmetic Surgery Center and Medical Spa. Joining us is Dr. Kiersten Riedler. Did I get your name correct, I hope?
Yes, you did.
Okay,
Thank
beautiful.
you.
Board-certified facial plastic surgeon for the center, and joined by her colleague. Did you say 31 years?
Yes.
31 years, started when you were an infant, I'm sure. Monique Ramsey, the Chief Community Officer for the center. Welcome to the show.
Thank you.
Very good. We'll start with you on this, Monique. So 31 years. How long has the center been in business?
We've been in business now getting close to 35 years.
Okay, so you started almost at the
towards the beginning, yeah.
What's the mission?
You know, we really want to empower people to feel great about themselves and have that confidence that they have inside them, that they know they have inside them, and, you know, just help turn whatever dream they have into a reality.
Right. So, Dr. Riedler, you've been involved with the center for how long?
For almost a year now.
For almost a year. Okay, very, very good. And did you grow up here in San Diego? I think I heard you say before the show started you did.
Yeah, so I was born at Scripps La Jolla and raised in San Diego. I went to La Jolla Country Day School and then was gone for about 16 years after I graduated high school for school and training and all that, and then finally got to come back to my hometown a few years ago, and I'm so happy to be back.
What got you into the medical profession?
Well, my dad was a neurologist, and I kind of always liked math and science, and majored in neurobiology in college, and really liked that kind of science, and then went to med school not really knowing what I was going to get into, really loved ear, nose, and throat, head and neck surgery. And so that was what my residency was in. And then facial plastic and reconstructive surgery is a subspecialty of that. And so that's what I ended up doing a fellowship training in. Nice. And that's what I'm doing now.
Great. Well, where'd you go to med school?
I went to med school at USC.
So, okay. I still like you, though. Okay. My dad taught medicine at UCLA.
Oh, wow.
Yes, right, exactly. Many, many moons ago. SE, great medical program as well. And have you been practicing pretty much just in Southern California? Have you practiced anywhere else?
Yeah, I've been practicing in Southern California. My fellowship was up at UC Davis and Beverly Hills, but I came back to San Diego the first chance I got.
And that's probably a great choice in that aspect of it. So, Monique, when people, you guys have expanded since you've been there, obviously, to say the least. And is cosmetic surgery and everything you folks do, is that a field that is growing? Are more people getting interested in it? Obviously, 31 years ago, the science has changed quite a bit and so forth. Talk about that.
Well, you know, I think people always have something that they're kind of wanting to make better about themselves, and whether it's, you know, being more healthy in their lifestyle, what they eat, but it's also sometimes there can be things that just you don't like about yourself. And so over time, what I've really seen is, you know, it's gone from just the plastic surgery side to having all these things in the medical spa that are non-invasive or minimally invasive for people to sort of dip their toe in the water. Not everybody wants surgery, right. or maybe they do, but at a later date. And so there are so many now with fillers and Botox and all the different injectables, a lot of things that you can kind of do to make little changes. And it's been growing exponentially.
Right. So do you work in the medical spa as well?
I do. Yeah, I work in both.
So someone comes in and says, hey, Dr. Riedler, I want to get blah, 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 blah. Mm-hmm. And you go, you really don't need blah, 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 blah. You need this over here. Does that happen quite a bit?
I would say that happens occasionally, but often I will have patients come in and say, what I ask them more is not what treatment do you want?
Right.
Is what bothers you, or what are you looking to improve? What are your goals?
Right.
And then knowing their goals, then I can kind of direct them to what I think is the best solution for them. And, and I might start with them in the med spa and go to the surgery center, or start in the surgery center and and end up in the med spa. And I would say almost all my surgery patients, I treat in the med spa also, because it's, skin resurfacing, Botox, lasers, those are all kind of integral to, improving your overall appearance. And
Sure.
we're not going to just treat one thing surgically and then stop. We're going to kind of keep your skincare regimen and, do all of the, do all of the treatments we have at our disposal.
Right. It makes all the sense in the world. We are chatting with Dr. Kiersten Riedler. She's a board-certified facial and plastic surgeon for La Jolla Cosmetic Surgery Center and Medical Spa. Joined by her colleague, Monique Ramsey, the Chief Community Officer for the spa. I'm Drew Schlosberg, and you're listening to another edition of Drew Schlosberg's Spotlight on the Community Show, brought to you by Mission Fed Credit Union, doing great things in San Diego for 60 years. It's an interesting point, because so much has changed, obviously, since you've been involved with it for you, Monique, and then, of course, just even you going to medical school, probably a million things have changed in that aspect of it. So do you think people are getting more comfortable now with cosmetic surgery that they weren't before? Because, yes, listen, people do hear these horror stories, right? And that's because something went awry, on that aspect of it. But talk about that, Dr. Riedler. People get much more comfortable, I imagine, with this, correct?
Yeah, I think it used to be very taboo, and people would, hide and not want to tell any of their friends or family if they had cosmetic
disappear
surgery.
For a year and go, yeah. Oh my goodness, what happened to you?
Yeah, but now it's, people are a lot more comfortable with it. They're not ashamed of it. And I think a big reason for that is that we have all these non-invasive or minimally invasive treatments, and, nobody's embarrassed. Well, not that I know, but at least nobody's embarrassed to get Botox or a little filler or something like that. And so that's just kind of, and it's the same thing with surgery. It's, I'm just bettering, there's something that I want to improve about myself, and people aren't ashamed of that anymore. So I think that's nice.
Right, exactly. So, Monique, when someone is interested in getting some of the services and programs that you folks do, is there a survey or something they fill out on the website so at least you know what's going on, or they just make a cold call and come in and I'm going to talk to Monique about it, even though you're not a practicing surgeon, for God's sake? How's that work?
Well, we have over time, there are the patients who will say, I know I want X. Right. But a lot of people just know what's bothering them that they want to improve, like Dr. Riedler said. And so we came up with something super innovative just in the last year, which is called our treatment planner. And it asks you just a couple questions, and then it will display all the treatments or surgeries that will help with that area. It gives you, before and afters and price ranges, and, is downtime more important to you, or is the expense of it, is what's the most important thing? And so it really helps patients who maybe aren't as well versed, because there are patients who do all their homework on the internet and they come in and they kind of are totally fixated on one path. But for the people who say, I just don't like what's under my neck, how do I deal with that? Where do I start? And so you can go put that in, and it will plop out all the different things that, are available, and all under one roof, really, at La Jolla Cosmetic. Because whether it's something that's, skincare up to surgery, we can help guide you the right direction.
Yeah, that brings up a good point. So let's say someone comes in, Drew comes in to you, Dr. Riedler, and says, I don't like anything from the hair down, for God's sake. But not quite that bad.
We can help hair, too.
Yeah.
I do have hair. I
don't know about feet, though.
I don't have feet. Yeah, exactly. No, and literally, okay, we'll use that example, something underneath my neck. I need to get rid of some of this. Would you guys say then, what you really need to do is quit eating so much, or you need to exercise, or you need to do a little bit of both, but our spa can help you because we can do these types of things? Am I on the right track, or am I not right?
Yeah, what I'll often ask people if they feel like first I'll evaluate the area under the neck. Sometimes it's fat, sometimes it's skin.
Right.
Sometimes it's both. and sometimes it's actually muscle bands. So evaluating kind of what the actual problem is, step one.
Right.
If you have extra skin, dieting is actually going to make it worse.
It just get even
you're just going to have more. Yeah, you're just going to have more saggy skin, basically. So that's how we can help patients is by identifying the cause, because looking at the actual anatomy underneath and what's going on, and then going from there. But the nice thing is that we almost always have a range of treatments available, and depending on what your goals are, and sometimes. Weight loss, I would say less so for a facial plastic surgeon like me, is weight loss going to be part of the treatment plan, but a lot for our body surgeons who are doing liposuction and body shaping. It's definitely a part of the treatment plan with them.
Yeah, I want to save this for the second half of the interview. About myths about plastic surgery. That once you get it, you're going to have to be coming in every 5 seconds to get something done and all that business. And once they do it, you'll never see La Jolla Cosmetic again. Untrue. You'll see them as much as you want to see them in that aspect of it. But I was very intrigued to see that you're involved with the VAPA Foundation. They are frequent guests on our show. Love those guys. How long have you been involved with VAPA Foundation?
So it's been a few months now that I've been involved with VAPA. And, having grown up in San Diego and going to Holy Country Day, I was really fortunate to be involved in their instrumental music program. And played violin from 3rd grade on, actually through college. And so I really wanted to kind of get involved in music again, and was so pleasantly surprised to find out about VAPA and that they have a great program going on for San Diego Unified School District, and help provide musical education to our students.
Right. The reason why I'm smiling is I worked for San Diego Unified a billion years ago, and as a curriculum developer, and one of my close friends ran VAPA. And I've said for many, many years, and if I've said it, I'm sure 4 billion other people have said it, or if they haven't said it, they've thought it. But I'm really passionate about this, especially been a curriculum developer. You can teach every single content area: science, math, language, arts, history, social studies, chemistry, applied mathematics, 75 other topics just through VAPA. I'll throw in athletics as well in that area. For the life of me, I don't understand why that's the first thing that's cut. And I only said this 4 billion times on my show because anytime I get a chance to talk about it, we have a lot of theater folks on. I said, that's all you need to do, because you can do all that aspect of it. So, thank you for doing that and being part of it. Because I think when more people understand that the mental health aspects of being involved with visual performing arts is just off the rails in that area. So that is terrific. So you don't play violin anymore?
No, I do. I don't play formally, but I played with the kids at Fiddle Fest recently. Nice. And that was really fun.
So you play bluegrass too?
Yeah.
Okay.
Yeah. I play all sorts of songs and genres.
Sure. Yeah. My daughter played the violin, and unfortunately stopped playing. She was asked to be in part of the junior symphony. But Dad, I just want to play outside. All right, knock yourself out and have fun and all that business. We're chatting with Dr. Kiersten Riedler. She is a board-certified facial plastic surgeon for La Jolla Cosmetic Surgery Center, and joined by her colleague Monique Ramsey, the Chief Community Officer. I'm Drew Schlosberg of Cloudcast Media. We come back from break. I want to talk a little bit more about how people get a hold of you folks, Monique. Maybe Dr. Riedler, you can talk about some myths about plastic surgery, and then most important. Monique probably remembers this. We always say, part of the second segment, what could our listeners do to support what you folks are doing, or support what you'd like to do with the VAPA Foundation? How's that sound?
Sounds
okay,
great.
Very good. I'm Drew Schlosberg, and you've been listening to Drew Schlosberg Spotlight on the Community Show here at Cloudcast Media, brought to you by Mission Fed Credit Union, doing great things in San Diego for 60 years. We will be right back.
When you do your banking with Mission Fed, you get great rates on auto and home loans. That's good for you, but something good also happens for a lot of other people. We're not for profit, so we put money back into the community to help lots of great nonprofits to keep San Diego strong. So you're not just getting something good, you're doing something good. Come to Mission Fed. It's banking that's good for all.
Brand amplification is the DNA of Cloudcast Media, and our code is the powerful blending of sound, voice, and storytelling to lift local brands and their communities. Whether it is our Brandcast, Schoolcast, or Causecast platforms, the unifying ethos is all about this community, the one you call home. If you dare to dream and want to explore the brand amplification of Cloudcast, a national leader in local podcasting and other Winfluence strategies, please visit us at cloudcast.us.
I'm Drew Schlosberg, and you're listening to Drew Schlosberg's Spotlight on the Community Show, brought to you by Cloudcast Media and Mission Fed Credit Union, where the credit union's been doing phenomenal things for San Diegans for 60 years, joined by our friends from La Jolla Cosmetic Surgery Center and Medical Spa. Dr. Kiersten Riedler, board-certified facial plastic surgeon, is chatting with us today, along with her colleague, Monique Ramsey, the Chief Community Officer. And you were going to give us a link or point us in a direction that people can help support some of the great work that Dr. Riedler's doing with the foundation or other things.
Yeah, so we have always believed in giving back to the community. And, you know, it's a beautiful thing to work with a group of surgeons and professionals who deeply care about giving back to the community. And we've done it our whole time since being in business. And so we have a giving back page on our website, and you can go to glamfam.com and then look up under About Us, I think, there's a giving back page. And then you can see all the different organizations we support, from VAPA to Humble Design San Diego to Promises to Kids and Las Patronas, because they support so many different charities throughout San Diego County and make huge impacts. And we're making a positive impact on our patients' lives, but we also want to make that positive impact across the community. And so you can go, learn more about what we do and how we give back. And then we have links. So if you feel so inclined and you want to throw a little support their way, we really encourage you to do that.
Yeah, why don't we do this next time? We're far from over with the interview, but next time you're back in the studio, why don't you folks bring in one of the nonprofits that have benefited, and then Dr. Riedler, maybe a patient that wants to talk about the cool things that they've done, if they want. Don't want to break any HIPAA rules, don't want to break it. But a lot of people like to say, listen, I never thought this could happen. It's changed my life. It's got me more self-confidence and blah, blah, blah. Mm-hmm. And we love sharing those stories as well. So if you're interested, we will absolutely do that. Sure. So Dr. Riedler, what are some of the myths about plastic surgery that once you get it done, you can just forget about it and then never see us again? Or how does that work?
Oh, no. Yeah. No, I follow my patients pretty closely. After pretty much every type of surgery I personally do in facial plastics, I'll see patients sometimes the next day, a week, a month, 3 months, 6 months, 9 months, 12 months. And it really and that's one of my favorite parts, because I really get to develop a long-term relationship with them and get to know them and their families and, see their progression and see their new self-confidence. And and actually when I start seeing them less often, it's kind of sad for me because,
right, sure.
because I get so close to them. So it's not like a one and done, see ya, have a nice life. They're coming back and then I'm seeing them often in the med spa too. And so it's a really kind of a long-term relationship that forms.
Do you do surgeries on, those folks who are born with, some disformities, maybe, hair lips or something to that effect, and right out of the gate, listen, we need to get this taken care of, yes or no?
So now in my practice, I don't do that so much, right, because in the past, in training and fellowship, right, and subsequently I did. What I realized is that especially with cleft lip and palate, it's really key to be at a university or at a children's hospital like Rady's, or like we had at Children's Hospital Los Angeles, where you have the full team at your disposal. And we had a cleft clinic where all the different departments would be there. So I don't do that so much anymore, but I do cleft lip rhinoplasty, which treats the deformity that, the nasal deformity that results from cleft lip. So things like that.
Yeah. When somebody comes in and they have an issue with, money, whatever, because I'm sure it's not inexpensive, but it's probably not as expensive as people think, to be honest with you, as well, on some of the things. Do you offer, scholarships is probably not the right word, reduced prices at all? Do you work with them? How does that work?
Yeah, so we have a number of financing options.
Gotcha. Okay.
And a lot of our patients use those options, no interest. And then, we have various discounts for if you're a former patient or friends and family or.
Well, we also give discounts for military.
Oh, nice. Okay.
So that, we really believe, again, part of giving back. I mean, they give a lot and we like to give back. But yeah, financing is something that, in the car world, we all think about, it's $179.99 a month. But really, that is so common in plastic surgery, and I don't think people realize it. Or even for things in the med spa that might be a little on the pricier side, there are ways to make it really affordable. And that's what I love, kind of being the non-medical person on the team, out of the group here, is that, we want to help you make it achievable, and you can, have what you want today and be paying over time, and it makes it so that you're not having to delay that. It's not being put on layaway.
Right.
But I mean, and the economy right now, things are tough, and so, but these are still things that people want and want to do for themselves, and so it is absolutely very common. And we have our patient care coordinators work with many different financing companies so that they'll find the right fit for what you're thinking of. And I think that's really nice that it's accessible.
Right. Is there like a waiting list? I'll start with you on this, Monique, and then you can jump into Dr. Riedler, that on a certain type of a request. I mean, is there one type of surgery or a med spa type of request that, boy, join the crowd, we'll get you in about 6 years, because there's so much of that. Is there such an animal like that?
I don't think so.
So no wait, basically.
No, I mean,
for the most part.
I think people can get into any of our doctors or med spa providers within a week or two.
Oh, that's fantastic.
And then, surgery it kind of just depends on what the surgery is and how long it's going to be. But we have our own accredited surgery center on site. So we have our own schedule. We're not dependent on a third-party ambulatory surgery center for when they might have an opening. We have our own.
Yeah.
So
well, what's good to hear about that, because almost every other business in the world now is shorthanded. There's like 2 waiters now working at your favorite restaurant, and God knows what. And we understand, the pandemic, and but with medical stuff and things like this, it's they hit it as well too. A friend of mine is the CEO of Scripps Health, and Chris Van Gorder is the name, and was tough stuff, with all these things going on. So that's good to hear in your area. Dr. Riedler, what can our listeners do to help support your efforts, whether it's with VAPA Foundation or whether it's just in the business you do?
Yeah, so I mean, a lot of our options or ways to contribute are on our website. As Monique mentioned, there's the VAPA Foundation. You can go to their website. You can go to our website and link to theirs and contribute. It's just a really excellent cause that really benefits all the kids in San Diego Unified School District. There's also Promises to Kids, which is another great foundation that we really love to work with.
It is.
Yeah, and you can, I used to volunteer at the Polinsky Center when I was in high school.
Right, exactly. No, they're 100%. And so, Monique, what number do they need to get a hold of?
Well, you can carrier pigeon,
I know carrier pigeons.
Text, email, or cell phone. If you just go to glamfam.com, then that every way you can even do some of the med spa appointments. You can just book it yourself. You can book online.
That sounds great. Well, thoroughly enjoyed the conversation. Promise you'll come back.
Absolutely.
Come back with an organization that you folks have benefited, and certainly a patient of yours, Dr. Riedler, that is thrilled with results. That you're going to be tough for you to choose which one you're going to bring back in. But wishing you folks nothing but great success moving forward.
Thank
you so much.
Thanks for having us.
Oh, my pleasure. I'm Drew Schlosberg, and you've been listening to Drew Schlosberg Spotlight on the Community Show, brought to you by Mission Fed Credit Union here in this wonderful studio here in Scripps Ranch. We've just been hearing a great episode from an interview with La Jolla Cosmetic Surgery Center and Medical Spa. I think you will enjoy it.
You've been listening to an episode of Drew Schlosberg's Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego community. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
Cloudcast Media.